Hello everyone, my name is Dr. Omar Akram and today I will talk about the myths and the facts related to the COVID-19 infection. It has been believed that the COVID-19 infection is basically a disease of cities. It is a totally wrong perception. It is infecting everyone. Why the cities are more infected? Because of the more gatherings and the more populations among the cities are residing. So follow the SOPs, wear your mask, maintain 2 meter distance at least, wash your hands regularly. It is not a disease of cities. It's untrue. Another perception among the people is that they think that the coronavirus can be killed by the extreme of the weathers. Either a very hot weather or very cold weather can kill the coronavirus. It isn't true. The weather has nothing to do with the coronavirus. It is only can be terminated and can be stopped by following the precautions of the maintaining distance and washing your hands regularly and avoiding the public places. People also think that COVID-19 and the coronavirus is just like a simple flu. It's totally untrue. Couple of patients were seen 5 to 6 months back in China, Wuhan, and now this disease has been spread in almost every country of this globe. It is a very serious illness. It can infect any organ of the body system. People can have the loss of smell, loss of taste, diarrhea, dry cough, fever. So whenever you have the symptoms, always consult your doctor. It has also been believed among the population that they don't need any kind of isolation till the arrival of their laboratory results. This is also untrue. Whenever any physician advises you to get tested for the coronavirus, you are advised to keep yourself isolated till the arrival of results. Either it comes after 72 hours, either it comes after the 48 hours. Keep yourself in isolation. If you are negative, you can go outside. If you are positive, remain in the home isolation and follow your country's SOPs. In the end, I would like to say, don't panic, keep yourself calm, maintain a distance of 2 meters from others, use your hand sanitizer frequently, wash your hands regularly, almost for 20 seconds. In the end, I would like to say, keep yourself calm, don't panic, maintain a distance of 2 meters from others, wash your hands with soap regularly for almost 20 seconds. Use hand sanitizers frequently. Wear masks whenever you are in the public. Avoid gatherings. When you feel you are symptomatic, always consult your doctor. Go to the nearest healthcare providing facility. Stay home, stay safe. Whenever, unfortunately, if you tested positive, follow the isolation protocols and inform your lost contacts to get help them not getting spreading infection. People also think that COVID-19 and the coronavirus is just like a simple flu. It's totally untrue. Couple of patients were seen 5 to 6 months back in China, Wuhan, and now this disease has been spread in almost every country of this globe. It is a very serious illness. It can infect any organ of the body system. People can have the loss of smell, loss of taste, diarrhea, dry cough, fever. So whenever you have the symptoms, always consult your doctor. It has also been believed among the population that they don't need any kind of isolation till the arrival of their laboratory results. This is also untrue. Whenever any physician advises you to get tested for the coronavirus, you are advised to keep yourself isolated till the arrival of results. Either it comes after 72 hours, either it comes after the 48 hours. Keep yourself in isolation. If you are negative, you can go outside. If you are positive, remain in the home isolation and follow your country's SOPs. People think that asymptomatic patients who are tested positive during the routine screening, they don't need isolation. It's totally untrue. Everyone that is a positive having the PCR, they all need isolation. Follow your country SOPs of isolation either in the isolation centers or the home isolation. You are fine. You are asymptomatic, but you can transmit the disease. You can transmit the disease in your family, among your friends, in every gathering wherever you go. So this is an infectious disease, so take precautions. Use of the drugs that we see in newspapers and the social media like hydroxychloroquine, anti-malarials, remdesivir, tocilizumab, dexamethasone. All these medications are under trial. Nothing is being yet been proven which is the treatment of the coronaviruses. So don't run for this medication. Don't run for this to getting all these medication. These are only be used by authorized prescriber and you're only the doctor can prescribe you and that can only be used in a specialized healthcare setup under strict monitoring and surveillance. Another one of the biggest myth is lockdown. So what is lockdown? Get your all stuff and go to the hill areas. No, it's untrue. The lockdown is that it is being imposed just to contain the viruses, to keep the infected people away from those who are healthy. Lockdown doesn't mean that pack your belongings and go to the hilly areas to visit your friends, your families, and go in the gathering. The lockdowns is actually meaning the stay at home, stay safe, and keep yourself away from the infection. Oh God, another myth. I'm COVID positive. Oh, I will die. The first step, don't panic. Keep yourself calm. Whenever you have the symptoms and you get tested positive, just contact your doctor, isolate yourself, and use the social media. Put a pretty good status at WhatsApp, Facebook, and all these the social media's accounts that I was getting tested positive. All my contacts in last visits, please get tested yourself. So when they have any kind of symptom, they can also test. Go for the test. They can also consult your doctor. And such way you can help others to contain the virus. So don't you worry. Another myth is that the multivitamins are life-saving. It's untrue. Multivitamins have no role in the treatment of the coronavirus. However, they are also injurious to your health if you are taking in large quantity. Always use multivitamins after the consultation from your doctor. Many people believe that when the reading on the pulse oximeter is less than 92, they're gonna to die. It's not like that. It's totally untrue. Every person have their own levels. Whenever you found any symptoms, visit your nearest hospital, visit your treating physician. Don't treat yourself If you are not been infected, don't use such kinds of the gadgets. It's not for you. It's only can be used by the healthcare physicians, and after the advice of the veterinary physician, then you can only use. So don't panic. People also believe that the government is doing the burial of the deceased itself because they are using the organs of the COVID-19 patients for some kind of transplant. Isn't true. Not a single organ of the COVID-19 patient can be used for the purpose of the transplant. So the purpose behind the burial by the government is just to contain the virus, to keep the peoples away from the infected dead body that can lead to the spread of the virus again. So follow your country's own SOPs regarding the burial process. It has nothing to do with any kind of the transplantation. It is also a wrong perception. People think that COVID-19 coronavirus cannot be separated from the dead bodies. It, it's untrue. It can be separated from the deceased body because of secretions and anything in contact with them. Uh, so always take the precautions of the burials and use the distancing of the 2 meter. Wash your hands regularly. Don't touch the body without gloves. So keep the precautions and take precaution according to your country SOPs. In the end, I would like to say, don't panic. Keep yourself calm. Maintain a distance of 2 meter from others. Use your hand sanitizer frequently. Wash your hands regularly, or most for 20 seconds. It has also been the belief and the strong belief among the populations that the washing the body with chlorine and alcohol will kill the virus. It's totally untrue. It has nothing to do with the coronavirus. Bleach and other disinfectants like sodium hypochlorite kill the viruses. They can only be used to clean the surfaces and the washing of the hands. They are more harmful, they are more injurious to your eyes, to the rest of the body. So avoid them using them. It is also been that this myth prevailed in Iran, where a lot of people drink some kind of disinfectants and many mortalities were reported. So use of such disinfectants on your body or drinking is strictly prohibited. Another myth is that antibiotics can kill the coronavirus. Antibiotics only works against bacteria, and only a specific antibiotic act against a specific bacteria. One antibiotic not killing the every kind of bacteria. The same way we need antivirals to treat coronavirus. And still now we are not aware of which antiviral is best and most effective against the coronavirus. So antibiotics have no role in the treatment of the coronavirus. People also think that the children are not being infected by the coronavirus. Isn't true. Children are also being infected from the coronavirus, although the incidence is less, and the severity of illness is also less, and the recovery rate is faster. But the children are infecting from the coronaviruses, and they can be the spreading the infections if not taking the precautions. Another myth is that the home remedies can cure the coronaviruses. Every home have the different kinds of the home remedies, and it's vary from the home to home. It vary from country to country. People think that this is the final treatment of the coronaviruses. The use of the different kinds of techniques like gargling with the hot water all the day, taking bath with the hot water, use of the steam inhalation, and the drinking cocktails having a lot of spices and herbs. It had nothing to do with the treatment of the coronavirus and is totally untrue. People think that doctors are using some kind of lethal injection to kill the admitted patient of coronaviruses. They think like this way we are trying to contain the disease and for not letting it spread. It's untrue. Why such patients are kept in isolation and why we doctors wear some kind of PPE, the personal protective equipment that bother most of the population. It is basically coronavirus is a highly infectious disease. It can spread from person to person. Keeping them in isolation, the basic aim is that to contain the virus, to move the person who can be the further source of the spreading the infection in an isolation will not only keep others healthy and safe from the coronavirus, but also that patient which is also suffering from the coronavirus can be highly monitored under the surveillance and being treated up to the mark. Another myth, pneumonia vaccine can save the people from the coronavirus, is untrue. Pneumonia is an infection of the lungs which most of the time affect the people at the extreme of the ages. It is also non-infectious disease. It has nothing to do with coronavirus. Coronavirus vaccines are under trial and are being used in many countries under surveillance as well as detailed monitoring. People believe that the pneumonia vaccine can actually save them from coronavirus. It's not like that. It's untrue. Pneumonia is an infection of the lungs which most of the time affect the people at extreme of the ages. It has nothing to do with coronavirus. The coronavirus vaccines are under trials and currently being utilized in most of the countries under the surveillance and the detailed monitoring. It has been believed among the populations that COVID-19 infection is not a disease and it even doesn't exist. They think that it's a government created propaganda to divert their attention from the cumbersome situation of the economy and as well as the rising inflation. It's untrue. It is the most disastrous situation that our whole humankind is facing in the history. It is infecting everyone regardless of his age, regardless of his color, religion, race, country and the continent. And everyone is getting infected. The only thing that we can fight with is realize the situation and follow the SOPs. In the end, I would like to say keep yourself calm, don't panic, maintain a distance of 2 meters from others, wash your hands with soap regularly for almost 20 seconds, use hand sanitizers frequently, wear masks whenever you are in the public, avoid gatherings. When you feel you are symptomatic, always consult your doctor, go to the nearest healthcare providing facility. Stay home, stay safe. Whenever, unfortunately, if you tested positive, follow the isolation protocols and inform your lost contacts to get help them not getting spreading infection.